Good morning, students. This lecture is for all the medical field students. We are going to discuss today about what is ligand. Okay. Before knowing that what is actions, what is pharmacological action, what is agonist, antagonist, we should know about a ligand in pharmacology. Students, those are recently introduced with the pharmacology. Recently they have the pharmacology subject in their syllabus. So this video is very useful for them. So let's get start. Let's get know what is ligand. So the ligand is something that binds with a biological molecule to form a complex and produce some biological and pharmacological effect. ligand ये एक ऐसा मॉलिक्यूल, ऐसा सब्सटेंस, ऐसा कंपाउंड और ऐसी मॉइटी है कि जो एनी बायोलॉजिकल सिस्टम को, एनी बायोलॉजिकल मॉलिक्यूल को, एनी रिसेप्टर को बाइंड हो करके बायोलॉजिकल और फार्माकोलॉजिकल इफेक्ट प्रोड्यूस करती है. लिगैंड्स फ्रीक्वेंटली रेफर्स टू सब्सटेंस दैट बाइंड टू रिसेप्टर्स. जो सब्सटेंस रिसेप्टर को बाइंड होते, जो सब्सटेंस रिसेप्टर्स को बाइंड होते हैं, उनको फ्रीक्वेंटली लिगैंड्स कहा जाता है. So in this video you can see this is the ligand which is bind to the receptor and it try to proceed further cellular activity. Okay, this is what a ligand. So simply ligands are classified by effect upon binding to the receptor. Some ligand activate receptor and produces excitatory response, and some ligand produces inhibitory response. Okay, so accordingly receptor having two types, antagonist and agonist. Tend to be smaller molecule that affect activation of receptors. Note, this may result in stimulation or inhibition of cell and organ function. This is all about ligands. This is all about ligands. Okay. Then type of agonist. Agonist means a smaller molecules which activate receptor and potentiate the excitatory or stimulatory or positive effect of that cellular activity and activate the receptor action. Okay, so type of agonist: full agonist, partial agonist, inverse agonist. So we will see all of the types one by one. So full agonist, the ligand that increase the activity of receptors and produce the maximal response. The ligand that increase the activity of receptors and produces the maximal response. एक ऐसा ligand जो by binding to receptor मैक्सिमल रिस्पॉन्स प्रोड्यूस करता है इन पॉजिटिव मैनर, इन एक्साइटेटरी मैनर, इट्स कॉल्ड अगोनिस्ट. उसकी इफिकेसी ज्यादा रहती है, मीन्स मैक्सिमल. फॉर एग्जाम्पल मॉर्फिन is the agonist, which mimics the action of endorphins at opioid receptors. Endorphins is the endogenous molecule which mimic endogenous molecule, और इसको mimic करता है morphine. He is the agonist, okay, by binding to opioid receptors. Then partial agonist, as name indicate, it produces the partial pharmacological effect. It has partial efficacy. These ligands partially increase the activity of the receptors but do not produce the maximal response. Like full agonist, even when present in excess amount, अगर इस पार्शियल अगोनिस्ट को हमने एक्सेस अमाउंट में भी एडमिनिस्ट्रेट कर दिया, फिर भी पार्शियल अगोनिस्ट उसकी एफिकेसी, उसकी मैक्सिमल रिस्पॉन्स बढ़ाता नहीं है. ओके, फॉर एग्जाम्पल बस्पिरोन is an anxiolytic drug used to treat an anxiety disorder. Okay, to simplify the partial agonist concept, first we have one question. To simplify the partial agonist concept, we have one question, that is, why use partial agonist if it is not that much efficacious as compared to full agonist. We have full agonist to treat we have full agonist to go for it. Okay, so why use partial agonist? So answer is, full agonist may cause too much activation resulting in toxicity. Full agonist may cause too much activation resulting in toxicity or receptor adaptation on prolonged use that leads to desensitization or down regulations. Desensitization leads to tachyphylaxis or might be a tolerance. Okay, that's why partial agonist is important. The lower the efficacy of a partial agonist minimizes all the complications, which is desensitization, receptor adaptations, down regulations, tachyphylaxis, tolerance. Is all the concepts, all the terms we are going to discuss in upcoming slides. Okay. And third, inverse agonist. The ligands which decrease the activity, of an active receptor to their inactive state. ऐसे ligands जो inversely act करते हैं against that particular receptor activity. They're trying to down regulate the action of that particular receptors. Okay, it inactivates that receptors. For example, flumazenil drug act as an inverse agonist for the GABA receptor and produces angiogenic effect. GABA is a inhibitory neurotransmitter which relaxes or which sedate, but flumazenil act inversely and produces anxiety, produces angiogenic effect. Okay, genic stand for generation, angio stand for anxiety, angio stand for anxiety and genic, anxiety generation, angiogenic effect. Okay, so inverse agonist produces an opposite biological response. Inverse agonist produces opposite biological response to that of endogenous agonist or neurotransmitter, has negative intrinsic activity. Means that particular inverse agonist has intrinsic negative activity by binding to that particular receptor. That's why that agonist is called as inverse agonist. वो एक्शन इनवर्सली प्रोड्यूस करता है, उसको इफिकेसी है, वो भी इनवर्स. देन एग्जांपल ऑफ इट, GABA receptor, it is a agonist. Okay, produces a sedative effect, उससे sedation होगा. Whereas inverse agonist like benzodiazepine, which produces anxiety like effect, okay, opposite action. Then you can see the graph on screen. On y-axis there is a biological response, on x-axis there is a concentration of agonist, it's mean dose. MEC stand for minimum effective concentration, okay, which is therapeutic concentration, and MTC stand for minimum toxic concentration. As concentration of that particular agonist get increases, the biological response get increases with time, with concentration, with dose, in case of full agonist. And in case of partial agonist, it is just above the minimum effective concentration and get a plateau phase. So if we increase the concentration of that particular agonist, that is partial agonist, it can't increase their efficacy, okay, with increased concentration. This reflect is all about partial agonist. This graph reflect all about partial agonist, okay. Then overall summary, this is on y-axis there is a biological response, on x-axis there is a concentration or drug dose. Full agonist shows greater maximal response with greater dose. Partial agonist shows partial response with greater dose. Neutral antagonist and shows which is inactive, no response with increasing dose. And inverse agonist shows inverse response, down-regulate response with increasing dose. Okay, this is a revision of agonist and type of agonist. So we are going forward towards the antagonist. So antagonist act against agonist, means they act exact opposite to agonist. Concept: the one drug decline or inhibit the action of another drug. That drug is called as antagonist, which inhibit the action of another drug. They have two types: a reversible antagonist and irreversible antagonist. So first point is competitive reversible antagonist. As name indicate, competitive. Antagonist and agonist compete for one receptor to bind on that receptor and produces their activity. Both agonist and antagonist have intrinsic activity towards that particular receptor. Both agonist and antagonist have affinity, have attraction towards that particular receptor, towards same receptor. Okay, so there is a competition. Block in competitive reversible antagonist block same receptor by forming weak bond. Weak bond indicate reversible. That particular antagonist can wash out. That particular antagonist can wash out from there. Whenever you increase the concentration of agonist, automatically it can overcome the action of or effect of antagonist. For example, atropine and acetylcholine. Okay, acetylcholine is the major neurotransmitter of parasympathetic nervous system, is cholinergic nervous system, and atropine is a act with sympathetic nervous system, which have both atropine and acetylcholine both have affinity towards muscarinic receptor. They are compelled to bind with that particular receptor, and that particular atropine produces antagonism for the acetylcholine. This is a competitive reversible antagonism. So competitive irreversible antagonism. Irreversible indicate covalent bond, strong bond, which cannot be dissociate easily. Okay, so have affinity for the same receptor sites and bind to an irreversible manner by covalent bond. Effect cannot be overcome even by increasing the concentration of agonist. आपने concentration increase कर दिया agonist का, फिर भी antagonist का effect overcome नहीं होगा, because there is no spare receptors for the agonist. Okay. Then this image indicate that how competitive antagonism work. Competitive antagonists have an affinity for a receptor, however do not have intrinsic activity as like agonist. Okay, agonists lack intrinsic activity. So first question will arise, what is intrinsic activity? So intrinsic activity is a measure of ability of a drug, that is bound to the receptor to generate an activating stimulus and produce a change in the cellular activity. Intrinsic activity एक ऐसा पैरामीटर है जो मेजर करता है ability of that particular ligands or that particular agonist by binding to receptor and generate stimulus to produce cellular further activity. Okay, you can see the image on your right side. Full agonist produces large stimulus, large cellular signaling, and it can lead to large effect. This indicates their intrinsic activity. Okay, and partial agonist produces small stimulus even in large concentration, even in large doses, and produces small effect. Note, major note, both agonist and antagonist can bind to receptor. However, only agonist molecule can activate the receptor. Only agonist molecule can activate the receptor. So only agonist molecule having the intrinsic activity. Okay, antagonist molecule don't have intrinsic activity, which inhibit the cellular activity, by binding with that receptor. An agonist potentiate that cellular activity and stimulus and excited that cellular activity by binding to that particular receptor. This is a difference. So what is affinity? Affinity is nothing but is a measure of the tightness with which a drug binds to the receptor. Affinity ये एक एबिलिटी है उस पर्टिकुलर ड्रग की कि वो कितने स्ट्रांगली, कितने टाइटली और कितना इफिशिएंटली बाइंड करता है उसके पर्टिकुलर रिसेप्टर को। ओके, ये उसकी एबिलिटी है और अफिनिटी से उसकी इफिकेसी भी डिपेंड है। अफिनिटी पे उसकी इफिकेसी भी डिपेंड है। सो नॉन कॉम्पिटिटिव एंटागोनिस्ट, पिछले टाइप्स में एंटागोनिस्ट और अगोनिस्ट दोनों compete कर रहे थे for same receptor. In this type, in non-competitive antagonist, there is another site for the antagonist to compete with agonist. In non-competitive antagonist bind to site other than the agonist and prevent the receptor activation by the agonist. Example, flumazenil by binding to benzodiazepine site. On GABA receptor, there is a GABA binding site and benzodiazepine binding site. Flumazenil bind to benzodiazepine binding site, and GABA is the inhibitory neurotransmitter which produces their action, which activate the GABA receptor and produces their action. But when flumazenil bind to benzodiazepine receptor on another site, it prevents the binding of GABA to a GABA receptor and that prevent the receptor activation by the agonist. That leads to prevention of receptor activation by a GABA, gamma aminobutyric acid. Okay, this is all about a non-competitive antagonist. So non-competitive antagonist, here you can see A represent a agonist, B represent a antagonist which is non-competitive. Okay, so on y-axis there is a agonist effect, on x-axis there is a agonist concentration. As concentration get increases, alone agonist increases their pharmacological response, increases their agonist effect. Okay, but in case of competitive antagonist administered with agonist, it covered the spare receptors. Okay, so there is no receptors for the action of agonist to bind agonist, so automatically its efficacy will get reduced. Okay, non-competitive antagonist in presence of spare receptors. This is presence of receptors. So A, agonist alone exhibit maximal response. Okay, in A condition there is only agonist and it have good efficacy and potency and affinity for that particular receptor. There is no any antagonist in A condition. Then in B condition, against plus non-competitive antagonist, the agonist still exhibit maximal response because there are spare receptors. स्पेयर रिसेप्टर मतलब एक्सेसिव रिसेप्टर, ज़्यादा वाले बाकी के रिसेप्टर्स विच इज यूज टू पोटेंशिएट द एक्टिविटी विच हैव लॉट्स ऑफ साइट टू give the scope for the agonist to bind to spare receptors and potentiate the excessive activity. So there is a spare receptors, however its affinity for the receptor is reduced. Then in case of CD, it is not until D, agonist plus higher concentration of non-competitive antagonist, that the agonists start to exhibit a lower maximal response as all spare receptors have been eliminated by the irreversible antagonist. Okay, by the irreversible non-competitive antagonist. All SPAR receptors are covered. All SPAR receptors are covered by irreversible non-competitive antagonist. So there is no receptor for the agonist to produce their action. So automatically its maximal response gate decreases. Okay, so what is SPAR receptors? Simple concept. SPAR means additional. SPAR means additional to what is required for ordinary use. It is a additional to what is required for ordinary use. So simply, SPAR receptors are the receptors that exist in excess of those required to produce a full effect. And the presence of SPAR receptors increases the sensitivity of agonist. जितने ज़्यादा SPAR receptors साइड पे होंगे उतनी ज़्यादा अगोनिस्ट की एक्टिविटी, उतना ज़्यादा अगोनिस्ट को स्कोप मिलेगा टू बाइंड विद all of the SPAR receptors and produces their action on maximum level. Okay, then comparison between agonist and antagonist. So agonist means a drug that occupy receptors and activate them. Then antagonist means drug that occupy receptors but do not activate them, and antagonist block receptor activation by agonist. Okay, so agonist produces their full activation. Then agonist plus antagonist, there is a less activation of that particular receptors, or in case of antagonist there is a no activation. So type of antagonism, there are 4 type of antagonism. First is physical antagonism, second is chemical antagonism, and third is physiological, and fourth is pharmacological. Okay, so we'll see one by one. Physical antagonism. It is based on physical property of drug. For example, charcoal. In case of alkaloid poisoning, we give the charcoal as an antagonist to that particular person who is suffering from poisoning. So charcoal have ability to adsorb the alkaloid on their surface. It attracts all that alkaloid from the stomach, and it prevents the absorption of further alkaloid into the blood and further poisoning of that particular alkaloid. Okay, so this is the example of physical antagonism. It competes physically with that agonist or with that particular poisoning drug. Then chemical antagonism, a type of antagonism where a drug counters the effect of another, where the drug counters the effect of another by simple chemical reaction, or it might be a neutralization of that particular drug. There is no binding of receptor, there is no physical interaction, there is a chemical interaction. Okay, for example, calcium sodium editate form an insoluble complex with arsenic or lead. If there is a arsenic poisoning or any lead poisoning, so we give the calcium sodium editate to that particular victim, and that calcium sodium editate form an insoluble complex with that arsenic and lead content and try to eliminate those and inactivate those and excrete those out of the body. This is all about a chemical antagonism. That particular calcium sodium editate interact chemically with that particular drug or with that particular impurities. Okay, then functional or physiological antagonism. In this case, there is opposite effect of two drugs on same function. Opposite effect of two drugs on same function. Two drugs act on two different type of receptors. Two drugs act on two different type of receptors and antagonizes the action of each other. Means it is a non-competitive antagonist. Those bind to different receptors and produces opposite action. It means physiological antagonism. For example, glucagon and insulin on blood sugar level. Glucagon increases the blood glucose level and insulin cover up or decreases the blood sugar level. Okay, or try to control or try to neutralize and try to maintain in limits. Okay, then type of agonism. First, summation. 1 + 1 is equal to 2. This is a simple way of explanation for the summation type of agonism. This is two drugs eliciting the same response but with different mechanism, and their combined effect is equal to their summation. मैकेनिज्म डिफरेंट होगा दोनों का, बट जो रिस्पॉन्स होगा वो सेम होगा. सेल्यूलर एक्टिविटी अलग अलग होगी बट आउटपुट सेम होगा. जो आउटपुट जो सेम होगा उनके दोनों के एक्टिविटी का जो प्लस होगा, जो समेशन होगा, दैट रिफ्लेक्ट समेशन पोटेंशिएशन अगोनीज. ओके, फॉर एग्जांपल aspirin and codeine, both are the analgesic, but aspirin decrease the prostaglandin level and codeine bind to opioid receptor and produces the analgesic activity. Both have different mechanism of action, okay, but produces analgesic activity. Okay, both have different mechanism of action but produces analgesic activity. This is a type of agonist. First, summation. Then additive. Combined effect of two drugs acting by same mechanism. Combined effect of two drugs acting by same mechanism means a drug which having same mechanism. So there is additive. Okay. Then synergism or supraadditive. It have formula 1 + 1 is equal to 3. It potentiate the both of the synergistic drug activity. The combined effect of two drug effect is higher than either individual effect. दोनों का इंडिविजुअल जो इफेक्ट है, एक्चुअल फार्माकोलॉजिकल इफेक्ट, उनके समेशन से भी ज्यादा और उनके एक्टिविटी को पोटेंशिएट करने वाला जो मैकेनिज्म है वो है सिनर्जिज्म. ओके, सो एनी टू ड्रग विच आर सिनर्जिस्टिक टू ईच अदर, फॉर एग्जांपल सल्फामेथाक्साजोल एंड ट्राइमेथोफाइन, दीज आर द सिनर्जिस्टिक ड्रग टू ईच अदर. ओके, so first point, what is tachyphylaxis? This is a major term in pharmacology, one of the major term. So what is tachyphylaxis? So tachy means rapid and phylaxis means protection, rapid protection. If something is coming again and again and repeatedly, there is a need to protect. There is a need to protect. Okay. So tachyphylaxis is the continued or repeated rapid or infrequent interval tachyphylaxis is the continued or repeated or infrequent interval exposure to a drug that may lead to weakened pharmacological response. In tachyphylaxis आप repeatedly कोई भी ड्रग फ्रीक्वेंट इंटरवल में बार बार दे रहे हो, उस ड्रग को एक्सपोज कर रहे हो टू द बॉडी. ओके, सो automatically that body find that drug desensitized, that may lead to weakened pharmacological response. It is also known as an acute tolerance. Okay, this presumed to be consequences of diminished receptor sensitivity in response to consistent stimulation by a drug agonist. बार बार that particular agonist को रिसेप्टर एक्सपोज होते होते ऑटोमेटिकली इट गेट लीड्स टू डिसेंसिटाइजेशन ऑफ रिसेप्टर, और रिसेप्टर स्टिमुलेट नहीं होंगे बार बार एक्सपोजर करने के बाद. सो दैट लीड्स टू tachyphylaxis. It is not like tolerance. Tolerance is different and tachyphylaxis is different. Okay, that all tachyphylaxis procedure or this all tachyphylaxis concept leads to diminished pharmacological activity for that particular drug which is repeatedly given to that particular person. Tachyphylaxis indicate this. There in this graph you can see there is a repeated stimulus bring about a diminished response, also known as desensitization. Okay, you can see there is a administration of that particular dose or that particular agonist in frequent manner in very short interval. Automatically that particular receptor are desensitized, they can't respond to that particular dose, and automatically pharmacological response get decreases. This is all about a tachyphylaxis. This is a desensitization. This is a cell membrane and this is receptor. Receptor at rest which is closed, and receptor when active which is open. And in desensitized receptor, whenever there is a agonist, but it can't, in case of agonist also it can't open, they can't, that particular agonist can't able to activate that particular receptor get desensitized. So what is tolerance? Okay, so tolerance is a person's diminished response to drug. Tolerance is a person diminished response to drug which occurs when the drug is used repeatedly, when the drug is used repeatedly and the body adapts to continued presence of drug, which occur when the drug is used repeatedly and the body adapts to the continued presence of a drug. For example, alcoholism. In alcoholism, if you getting one concentration of alcohol every day, body demands or your system demand, it needs more in that particular concentration. Body adapt that particular continued presence of that particular drug in that particular concentration, so body need more of that drug. Okay, it's like reward. So generally tolerance leads to increasing doses of drug being required to produce the same effect. Okay, automatically it leads to increase the intake. Body demands for that particular drug. Type of tolerance. Physical tolerance occurs at the cellular level, increases the rate at which the drug is metabolized. Increases the rate at which the drug is metabolized. So metabolism rate increases of that particular drug because body adopt that particular drug presence in your body. Okay, so metabolism rate increases, automatically demand will be increases. It is both demand and metabolic rate are directly proportional. Okay, so for this, that person will increase the administration or increase the concentration, increase the dose of that particular drug to get that particular reward. Example, when someone drink regularly, the liver will boost the production of enzyme that break down alcohol, allowing body to get rid of it quicker. Okay. Behavioral tolerance is the physiological or learn a person can become used to setting they use a drug at and not feel the effect of drug. Is physiological or learn a person can become used to a setting they use a drug and do not feel the effect of drug. सीधे भाषा में उस पर्टिकुलर आदमी को वो दारू अफेक्ट, वो जो ड्रग अफेक्ट नहीं करता एट पर्टिकुलर कॉन्सेंट्रेशन. उसकी बॉडी वो कॉन्सेंट्रेशन अडॉप्ट करके डिमांड करती है फॉर मोर concentration, for more amount of that particular drug. Example, think about the coffee. Again, do you feel more caffeinated when you drink coffee at work or at cafe? Think about it. Okay, then what is the difference between tachyphylaxis and tolerance? Simple. First, develop rapidly. Tachyphylaxis develop rapidly because of frequent administration, because of frequent interval administration. It develops rapidly. Tolerance develops slowly. For the long-term administration, in case of long-term administration, tolerance will get developed. Second, within few minutes it develops. Tachyphylaxis develop within few minutes. Tolerance develop within day or month. Third point, does not depend on dose. Tachyphylaxis does not depend on dose. It is depend on interval. It is depend on interval. Then high doses causes tolerance. So tolerance depend on dose. Fourth point, effect not seen even when dose is increased, like in case of tachyphylaxis. In case of tolerance, there is effect when dose will be increased. Fifth, not seen routinely in clinical practice. It is not seen routinely in clinical practice, but in case of tolerance, seen routinely in clinical practice. Most of the people develop the tolerance against most of the drug. Then example, ephedrine and tyramine are the example of tachyphylaxis. And the example of tolerance is opium, barbiturates, ethanol. Okay, ephedrine, tyramine, I will explain simply. Like for example, This is usually seen with the indirectly acting drugs, which are not directly bind to that particular receptor. Okay, so ephedrine and tyramine are one of them. So ephedrine, tyramine and amphetamine, they act by releasing catecholamine in body, the synthesis of which does not match release and store deplete rapidly. The synthesis of which does not match release and store deplete rapidly. And one of the major reason is slow dissociation of drug from the receptor is another mechanism responsible for the development of tachyphylaxis. Slow dissociation of that particular receptor from the drug, that is responsible for the development of tachyphylaxis. So this is the graph of tachyphylaxis as we have already seen, and this is the graph of tolerance. Slowly dose administration, slowly after a time it can the particular response, that particular percentage response get decreased, and your body demand for the more dose to attain that particular maximal pharmacological response. Okay, then what is addiction? What is addiction? Addiction is defined as chronic relapsing disorder characterized by the compulsive drug seeking, continued use despite harmful consequences and long lasting changes in the brain. पता है कि हार्मफुल कॉन्सिक्वेंसेस है इस पर्टिकुलर ड्रग के, फिर भी कंपल्सिव ड्रग सीकिंग is needed. Simply, addiction is an urge to do something that is hard to control or stop. For example, cocaine, heroin, alcohol. What is idiosyncrasy? Is an adverse reaction to an agent or a drug which does not occur in most of the patients who have used the same agent, and this reaction have no obvious relationship to dose or duration of therapy. एक ऐसी एडवर्स रिएक्शन जो कुछ लोगों में अगेंस्ट सम ऑफ द ड्रग्स प्रोड्यूस होती है, बट वही रिएक्शन, एडवर्स रिएक्शन सारे लोगों को नहीं होती. कुछ पर्टिकुलर जेनेटिक मेकअप वाले लोगों को ही वो इडियोसिंक्रेटिक रिएक्शन होती है. उसका कुछ भी रिलेशन नहीं रहता उस ड्रग के मैकेनिज्म ऑफ एक्शन से, उस ड्रग के डोज से, उस ड्रग के ड्यूरेशन ऑफ थेरेपी से, उस ड्रग के ड्यूरेशन ऑफ एक्शन से. ओके, दिस इज कॉल्ड idiosyncratic reaction, idiosyncrasy. Most common idiosyncratic reaction is skin rashes. Most of the people having this kind of idiosyncratic reaction problem for that particular drug, okay, or for that particular allergens too. It is also related to allergens. Some of the patient having allergens, allergy for the dust. Some of the patient having are allergic to weeds. Okay. This is all about today's session. Okay. Thank you. Goodbye.